Okay, let's get into this. Welcome to the deep dive. Today, our focus for you is all about a really crucial health check, the cholesterol blood test.
Right.
And we're going to look at it specifically through the lens of services and benefits right here in Oldham and Greater Manchester.
That's the mission. We've gone through the source material from Blood Tests UK, and what we want to do is, really unpack the most important facts.
Not just the facts, though.
No, not at all. It's about the benefits. Why this knowledge actually matters to you. We're here to answer one main question, really.
And that is?
Why should people in your local community actually care about getting this simple check done?
Exactly. Why does checking your body's fat levels, and that's the simplest way to put it, why does that matter for you and your family?
Well, the biggest reason is longevity. It's about proactive defense against heart disease. We know it's a huge health concern.
Of course.
What the studies show is that regular testing lets doctors find risk factors very, very early on. This kind of consistent monitoring, it buys you time.
Time to make changes.
Time to make really effective changes to your diet, your exercise. It helps you live healthier for longer, which, lines up perfectly with UK health guidelines.
And that's where the local angle really clicks into place, right? We're not just talking about some generic national advice here. The source material from Blood Tests UK makes it clear that local services in Oldham can give you really tailored lifestyle advice based on what they're actually seeing in the local community.
Yes, and that makes all the difference. It turns a number on a page into a real plan for your life.
Right.
And if you zoom out a little, the benefit just keeps growing.
Yeah.
The research suggests that when a community like Greater Manchester really commits to these simple checks, it saves a huge amount of money.
How so?
Fewer hospital visits. By preventing major heart problems before they happen, the community as a whole avoids these really expensive hospital stays. It frees up resources for everyone.
So a huge community benefit that starts with one small personal step. Just how simple is that step?
It's very straightforward. According to Blood Tests UK, the prep is pretty simple, but it's also key. You have to fast for 9 to 12 hours beforehand.
And fasting just means water only, nothing else.
Nothing else. And there's a good reason for that. It's not arbitrary. It's absolutely vital for getting an accurate reading on one number in particular, your triglycerides.
Ah, okay.
Yeah, those are the fats in your blood that can spike right after you eat, so you need that fasting period to get a true baseline. You also want to avoid any really strenuous exercise for a day or so before.
And the test itself.
The procedure is quick. It's a standard process, a simple blood draw from a vein in your arm. Clinicians call it venipuncture. It's a moment of slight discomfort for a massive amount of information.
Okay, so let's talk about that information. What do the results actually mean?
This is where it gets interesting. You get 4 key numbers back. First is your total cholesterol, then comes the breakdown. You get your LDL.
That's the bad one.
Often called the bad one, because it can build up plaque in your arteries.
Yeah.
And then you have the other side of the coin.
HDL, the good fat.
Exactly. HDL is like a little scavenger. It pulls cholesterol away from the arteries and back to the liver.
And the fourth number?
That's the triglycerides we mentioned, the ones sensitive to your diet, especially sugars. Knowing the balance between all 4 of these, that's what really tells you about your cardiovascular risk.
What about safety? Are there any risks with the test itself?
The risks are minimal. Really tiny. The most common thing is maybe some minor bruising where the needle went in.
And that's easy to deal with.
Very. You just follow the aftercare advice, put a bit of pressure on it, avoid lifting anything heavy for a little while. Simple stuff.
But the test, it's really just the starting line, isn't it?
It is. It's the foundation.
You have to actually use the results in your daily life. If your numbers could be better, that means, shifting to a heart-healthy diet.
Which means less saturated fat, less sugar, and more fruits and vegetables. More fiber.
And more exercise. That recommended 150 minutes of moderate activity a week.
Absolutely. And if your results do come back high, it's vital you follow up with your GP. They'll talk you through the next steps, which could be anything from lifestyle coaching to medication.
And if they're normal?
Then retesting is usually only needed every 4 to 6 years or so.
So the takeaway seems pretty clear. A regular check, something you can easily get through local services here at Oldham, flagged by resources like Blood Tests UK, it just gives you real power to take control of your heart health.
That's it. It's a simple investment in your own future.
A really powerful one.
So that leaves us with something to think about. If this kind of simple, consistent testing can improve health outcomes so much and save the community so much money, what other straightforward proactive checks could have that same kind of huge economic and social impact on your community's well-being.